Hello there. I'm Dr. James Zachariah, Bariatric Surgeon, Zuleika Hospital, Dubai. Today, I want to discuss with you why should we do endoscopy before any bariatric operation, whether it is a balloon, whether it is sleeve gastrectomy or a mini gastric bypass or a Roux-en-Y gastric bypass. Doing an endoscopy, in my opinion, and in the opinion of many world leaders and societies, is a must before we do bariatric surgery. There are surgeons who do endoscopy before bariatric surgery, and there are surgeons who do not do endoscopy for whatever reason before bariatric surgery. So, what is endoscopy? What is this upper GI endoscopy? Why is it done before bariatric surgery? A few things I would like to quickly mention before you plan and embark on a bariatric operation. Upper GI endoscopy is a test by which we can see the internal lining of the food pipe, esophagus, stomach, and the duodenum. This helps us to assess the condition of mucosa before we do bariatric operation. As you know, bariatric operation involves manipulating, altering some of the upper part of your stomach and intestine and areas around it. So before we embark on that, before we do something, we need to know the status of these organs. How does endoscopy help us in planning bariatric operation? The general population, there are many diseases, many afflictions that can affect the inner lining of the esophagus, especially at the junction of the esophagus and the stomach, called the GE junction, gastroesophageal junction. Some of them are ulcers, esophagitis, reflux, hiatal hernias, tumors, and so on. So we need to know these things, and we need to know the state of the inner lining. Has it been altered, especially in those who smoke, those who take alcohol, those who are having this constant reflux even before the operation. We need to know exactly what the status of the mucosa. Will it affect the operation? Yes, it will affect the operation. Some of the operations are known to produce reflux. Some of the operations are known to reduce reflux, and some of the operations increases the acidity in that upper part of the stomach or the gastroesophageal junction, leading to esophagitis. This constant irritation of the esophageal mucosa can result in some irreversible conditions that can go on hypothetically to become into cancer. So now, since I mentioned the C word, I would like you to consider this talk as a caution that you have, in my opinion, an upper GI endoscope before you plan a bariatric operation, and your surgeon can do it. As far as my patients are concerned, I offer them pre-operative endoscopy in the same time, same sitting before the surgery, for me to record and to plan the operation. And in some cases where there are symptoms, I even ask the patients that sometimes we may have to change an operation. For example, if you have been posted for sleeve gastrectomy, I take even consent that if in case during the operation I need to switch into a gastric bypass, you must give me the consent to proceed with the gastric bypass, because that is the best option for you. Now, there are times when we also discover a lax valve, which is called as hiatal hernia, which will give us the need for not just do a sleeve gastrectomy and come away, but to add a repair of the hiatal hernia along with the sleeve gastrectomy. That means two operations at the same time, so that you will not be having the problems of reflux as much as we can avoid and prevent, even in one sitting. Once again, this is just Dr. James Zachariah trying to bring to you some information that will be useful for those who are planning weight loss surgeries. Remember that I do pre-operative endoscopy for all patients, and it is done at the same time and is done including in the same package without extra cost. And this is an important thing that you have to consider, which goes a long way for your health. So I want to wish you the best for your attempts to lose weight. Do not hesitate to contact me at www.obesity-khalas.com. You can follow the address given on the screen to contact me, or through WhatsApp. I am available. for any of your questions. And till then, God bless. Bye.